internal rotation is really critical for walking and most movements that we do throughout the day. I also see a lot of people that are lacking in internal rotation. If you do not have sufficient internal rotation, then joints above and below will suffer. One of the first places that I see is in the low back. So you have tiny facet joints in the spine, and they have a tiny bit of lateral movement, but they should not have a lot. Now, if your hip is not moving internally, then you're going to get that lateral movement from the low back, and that wears on those joints and can create a lot of irritation and damage. Now, another place that will compromise, if your hip isn't moving, then you will find yourself swaying to move your whole body to be able to swing your femur through range of motion. So when that happens, your SI joints take a lot more abuse than they're meant to take. So your SI pain can get worse. So having the femur rotate is critical for the health of your pelvis, for the health of your low back, and also for your knees. As you swing your whole body to compensate for the lack of movement in the hip, in the femur, then you will wear on the inside of your knee joint. You'll find yourself putting a lot of pressure and wear on the inside of the knee, and that's not ideal. That's a good way to end up with knee pain and knee damage. So the easy solution is to make sure you have sufficient internal rotation of the hip. There's a couple of ways to make sure that you have that range of motion. There's some passive ways and there's some active ways, and we're just going to go through a couple of those. If you're sitting on a chair, then in just a comfortable position and your knees are at about 90 degrees, can you take your foot and bring it out to the side? So let me make sure the camera's got it. So are you able to keep your knee where it's at and bring your foot out to the side? So test both legs. You may find you have more on one side than you do on the other. You will probably feel the anterior part of the forward part of glute med turning on. You may even find that it cramps a little bit, and that's just good information that you need to do some work there. A passive way to test what kind of internal rotation is just to lay on your back, or is to lay on your stomach, bring your foot up so that your leg is in 90 degrees, and you're going to let your foot come out to the side. Now, the appropriate amount that it should come out is about 45 degrees. If you have 35, you're okay. Less than that, then you are expecting other joints to compromise for the lack of internal rotation of the hip. So test both legs. This is a passive way, so you should have more range than you do sitting in an active position. So take a look, feel what muscles feel stretched when you go into that position. Another way is to come into a 90-90 position, having 90 degrees out in front of you and then out to the side with a straight line from the bottom of your front foot through the knee to the heel of your back foot. Now, the back leg is in internal rotation. If you find that you are sitting way out here and your pelvis isn't, both sit bones aren't on the floor, then you know you have a little bit of work to do there. So we're gonna do some exercises and improve that range. This is totally doable, but it's also good feedback and might be a cue to why you are feeling low back pain or knee pain or pain in your SI joints.